Hi, I'm Gabriel Wong, physiotherapist and founder at West Coast SCI Physiotherapy.
My name is Natalie Fujisawa, and I'm a kinesiologist and clinical exercise physiologist at West Coast SCI Physiotherapy.
Why get active? Physical activity can help people with diabetes achieve a variety of goals, such as increased energy, improved mood, less shortness of breath, meaning daily tasks get easier, weight loss, improve cardiorespiratory fitness, improve blood sugar control, improve blood pressure and lipids with fewer medications. Fewer medications mean you'll often feel better with less side effects from the medications. Decreased rate of sleep apnea, meaning you'll get better sleep. Decreased kidney disease, decreased eye or vision problems, decreased rates of depression, increased sexual performance, fewer bladder problems, less knee and arthritis pain, better mobility, meaning it's easier to move, better quality of life overall, and lower healthcare costs. How much exercise do you need? To achieve optimal health benefits, current guidelines recommend 150 to 300 minutes of moderate intensity physical activity, or about half that amount if it's more vigorous activity each week. This would be in addition to strengthening activities 2 or more days per week.
We know most of you are just getting started with exercising.
This can be an excellent long-term goal for healthy individuals, including those with type 1, type 2, and even gestational diabetes. What's the difference between moderate compared to vigorous activity? The terms describe the levels of intensity for movement to allow people to achieve health benefits. Here's what these differences actually look like. Moderate physical activity. This would be an activity where you feel a faster heartbeat and a warmer body temperature. However, breathing and talking would still be comfortable. Vigorous activity, on the other hand, this would be an activity where you feel a substantial increase in your heartbeat, breathing, and body temperature. It would be difficult to maintain a conversation during these movements. Please note, however, that people with diabetes who have not previously exercised should consult with a medical professional before starting.
Okay, sure, but how do we know that? I know this sounds like a lot, and I know it might be kind of scary, but I want to go over a couple things and a few quick definitions to help you understand how to read physical activity guidelines and help you make changes that seem less overwhelming.
Physical activity is often confused with exercise. In fact, exercise is just one subset of physical activity. The World Health Organization defines physical activity as any body movement produced by muscles that require energy. This can be as simple as walking, dancing, biking, or doing household chores. Exercise, on the other hand, is planned, structured, and repetitive physical activity with the goal of improving the components of physical fitness, such as cardio. This would be an example of going for a walk with your family. Strength, like picking up a baby, for example. Speed, like chasing after your pets or trying to hurry to cross a road when the light is turning red. Agility, like maneuvering through a crowd of people. Mobility, like bending down to tie your shoes without having to sit down. And balance, like walking down the stairs without holding onto a handrail. To achieve optimal health benefits, an ideal goal will be to reach 150 minutes per week. That's going to be broken down to 30 minutes 5 days a week, or a little over 20 minutes per day each week. This would also include 2 days of strengthening exercises. Remember, however, it's the total amount of activity that counts. Activities that meet the definition of moderate to vigorous intensity can include structured exercise, if that's what you enjoy. But in reality, your 150 minutes of activity can also be accomplished by doing what we like to call neat things. NEAT is an acronym for non-exercise activity thermogenesis. This encompasses all the little movements you do in the day that are not meant as exercise, such as grocery shopping, doing the dishes, taking transit to work, or tidying up your house. Even the accumulation of low-intensity NEAT activities can improve your health. While these movements may not make as big of a difference as moderate to vigorous activities, it has been shown that increases in NEAT things and decreases in sedentary time can still benefit your health. So, if you are nervous about getting started with more activity or trying out some more structured exercise, Start by being more neat. Accumulate 10 or more minutes at a time for the best health benefits. So what kind of things can we do to increase your physical activity? Here are some ideas. Aerobic physical activity. Aerobic activity means training your cardiovascular fitness, otherwise known as cardio. Cardio has been found to be beneficial in bouts of at least 10 minutes at a time. Cardio includes the repetitive movement of large muscle groups. An example would be walking, running, biking, swimming, or dancing. The benefits include reductions in cardiovascular disease and overall mortality, slowing the development of peripheral neuropathy, which would be numbing in your limbs. Aerobic activity can also improve your blood sugar efficiency. Perhaps the most common benefit of cardio is that it can help you lose weight. Another interesting fact is that going from completely inactive to achieving 150 minutes of moderate to vigorous cardio is associated with decreased incidence of type 2 diabetes by 26%. Here are some examples of moderate intensity activities. Exercise can include biking, walking, or yoga. Sports can include shooting hoops, dancing, or golf. Playing can include throwing a frisbee. Exploring outdoors can include hiking, skiing, or canoeing. Housework can include vacuuming, raking the leaves, weeding in the garden, or scrubbing the floor or the bathroom.
While at work, this would include cleaning or reorganizing workspaces, carrying boxes, extended periods of walking.
Here are some examples of vigorous intensity activity. For exercises, you could think of jumping jacks or circuit training. For sports, think about basketball or pickleball. Playing, such as jumping rope. Exploring the great outdoors, including canoeing or rowing. And housework, such as carrying grocery bags while walking upstairs, shoveling heavy snow, or moving furniture. Muscle strengthening activities. Muscle strengthening involves exercising your major muscle groups such as your legs, trunk, and arms. This means applying enough load to your muscles and bones to improve strength. In order to increase strength, we must apply something called progressive overload. This means to progressively increase the difficulty of the exercise over time. To make this less overwhelming, try starting with movements that incorporate several body parts. For example, a squat would be standing up from a chair. This movement includes the torso, thighs, buttocks, and calves. Remember, to get the most health benefits, strength exercises need to be done 2 or more days a week. Resistance training benefits. Improves blood sugar efficiency, increases your strength, increases your lean muscle mass, increases your bone density, and prevents osteoporosis. Resistance training exercise is also very beneficial for prevention and management of type 2 diabetes. Combined programs of aerobic and resistance training shows the best improvements in blood glucose measures. Examples of muscle strengthening activities: body weight exercises, yoga, heavy gardening or moving heavy boxes, dancing, lifting weights, or walking uphill. The recommendations for physical activity are helpful as a general goal. However, significant health benefits can still be achieved even if you are well below the guidelines, especially if you're currently sedentary. Neat activities, such as walking around the block and gardening, all accumulate and can make a big difference. It is also important to note that doing more than the guidelines can also be beneficial if you are already meeting these recommendations. Remember, increased dose equals increased benefits.
It's really important to take time to figure out for yourself why you have actually chosen to get active. This will help you stay motivated and keep up with your exercises. Many people find it really hard to get started, and that's probably the most difficult part of an exercise program. Taking the time to dive deep into your true reason for exercise is really a great way to get focused and meet your goals. Exercise doesn't change things overnight, so for finding your why and keep moving forwards is really all about baby steps. Examples of meaningful goals: being able to play with your grandkids as they grow up or seeing them graduate from high school, Maybe it'd be keeping your garden healthy and maintaining independence living on your own. Improving the quality of your life can be a lot of things. Usually that includes losing weight, getting stronger, for example, going up and down the stairs easier, increasing your cardio, or just really getting yourself active. Another way is to find a buddy. Exercising with a buddy is always a great way to keep you motivated. Just keep in mind, especially with COVID, you need to keep yourself distanced and wear a mask. Keeping it fun and social is another great way to keep things less intimidating. Getting active can seem like a big chore, but having a buddy will make it more enjoyable, especially if you want to go for a walk, take up a new sport, or even take a dance class. Another alternative is to watch videos from home. YouTube is a great source for exercises. Give yourself movement reminders. Remember to decrease the time you spend sitting. In other words, don't sit for more than 30 minutes at a time. Remember to monitor your progress. Using step counters is a great way to do that. Either that, you might want to think about keeping a diary of your exercises, or even just talking to your friends about your goals. All those things will help you keep and stay motivated.
Here are some other ideas to keep you motivated. Make it accessible and remove barriers. Try to do stuff you can do at home. Always try to do what you like.
Beginner YouTube videos and home exercises are a great way to get started.
Put out your stuff you need before your workout the night before.
Try doing a few exercises during commercial breaks.
Do your exercise in small chunks. Workouts could be interval training, which is a shorter time commitment and has great increased gains in cardiovascular health. Help yourself stay committed by making sure you feel safe. An important factor is to check with your doctor before starting an exercise program,
This is especially true if you have other health conditions.
such as congestive heart failure, cardiovascular disease, have been previously sedentary, COPD, or chronic kidney disease. However, for most people, the benefits of exercise far outweighs the risk. In fact, exercise can also help you manage other symptoms such as osteoarthritis, fibromyalgia, rheumatoid arthritis, and other conditions that may seem limiting for exercise. Think about starting small and building up slowly. Remember, baby steps. If you have decreased sensation in your feet or legs, then try floor exercises or exercises you can do in bed or on the couch. Or try to focus on the upper body for exercises.
If you are nervous, overwhelmed, or just want some guidance on getting started, seek help from a clinical exercise professional, such as a kinesiologist or physiotherapist. Be sure to check if they have experience helping people with diabetes start an exercise program.
Here's a summary of the key points when considering starting an exercise program. 1. The health risks are much higher if you stay sedentary. 2. Always seek supervision when starting out. This could be from an exercise professional or finding a friend to work out with. 3. Start small and slow. Gradually increase. Remember, baby steps. 4.
If you have reduced or poor bone health, like people with osteoporosis for example, try floor exercises, chair yoga, chair strengthening, or water-based exercises.
Know the signs of low blood sugar. Low blood sugar, or less than 3.9 millimoles per liter, is the most common concern for those exercising with diabetes. This can occur if a person has not eaten carbs recently, or their medication activity peaks during or after exercise. Low blood sugar can also occur during or post-exercise, meaning it can happen immediately or up to 12 hours after exercise. The risk is decreased by monitoring blood sugar levels. With practice, a person can optimize their carb intake timing and their medication timing to ensure safety. It's best to consume some carbs when the blood sugars are less than 5.6 millimoles per liter. The risk can be reduced by eating some carbs before and after exercise. Also, performing resistance training before aerobic exercise can also decrease risk. Beware of shakiness, weakness, abnormal sweating, nervousness, anxiety, tingling of the mouth and fingers, and hunger. During exercise, it's best to keep glucose tablets on hand just in case. Also, exercising with a partner can also increase safety. Know the signs of high blood sugar. High blood sugar, meaning greater than 16.7 millimoles per liter, can occur in people who do not have adequate blood sugar control. People may exercise with high blood sugar as long as they feel well and do not have ketones present, but they should also not do vigorous intensity exercise until blood sugar comes back to normal. Blood sugar can temporarily increase with exercise as your body needs to send sugar to the muscles for energy. Be aware of frequent urination, fatigue, weakness, increased thirst, and acetone breath, meaning your breath smells like nail polish remover. People who have high blood sugars should be aware of their water intake as well, as they will likely need to urinate more frequently. This is even more important during exercise as the body tries to get rid of excess heat through sweat. Note, do not work out in extreme heat as there is higher risk of adverse events. Remember, continually monitor blood sugar before and after exercise.
So where do we begin? At the end of the session with my clients, I always like to give them a little exercise. Otherwise, they won't know where to get started.
Start by walking. You could set a goal of 10 or 15 minutes a day, 5 days a week.
If you walked 30 minutes a day, that would be about 150 minutes a week. A great goal to set for yourself.
For strength training, here's an example of some exercises you could do. These exercises would be great to do during your commercial breaks while watching TV. Sit to stands. This is just a fancy way of saying standing up from the sofa. Ideally, you would be doing this without the use of your hands, but I know this may be difficult for some people, so don't worry if you actually need to use your arms. Something else you could be doing during commercial breaks would be weight shifting. That is, leaning your body from one side to the other. Seated marching would be marching on the spot from a chair or sofa. Knee extensions would include kicking your legs out from a seated position. Quarter squats is just a smaller version of the sit to stands, as I mentioned before. For an upper body exercise, you could try wall push-ups. These may seem intimidating for some people, so here's a couple ideas you could try instead. Think about putting something in the trunk of your car. Try to spend a few extra seconds moving the items around. Another way this could be done is putting items away in your shelves. Remember, the goal is to try 10-minute bouts total. Here's some other ideas you could think about while doing your dishes to include a few minutes of exercise and strengthening for the upper body. This could include counter walks. It could also include an incline push-up. For example, when you're wiping your counters and tidying up, you could squeeze in a push-up here and there along the counter. Another strengthening exercise involves the back and arm muscles. In other words, we call this a rowing movement. This can be done while picking up a laundry basket or getting something out of a cabinet. Get creative and try repeating the movement a few times. Remember, we are always trying to do 10-minute bouts if possible. Another thing you could do is pull aparts, or perhaps even bicep curls. There's no end to your imagination. A lunge or split squat. Here's an example of how you could exercise while lowering yourself down to the ground while you're organizing something. It could also be used if you were playing with a young child and you need to stand up. Remember to stay safe and hold on to something if you require extra assistance or balance. Single leg deadlift. I know that sounds scary, but this is otherwise known as the golfer's pickup. Remember to stay safe and hold on to something if you require something for balance. Get creative when you're tidying up your house. See how much fun it can be? Deadlifts. I really don't know why they call it that, but this is a great exercise for the back of your legs and your lower back. Think about when you're bending down to tie up your shoelaces. Remember, if you feel you have poor balance, remember to do this close to a wall or something you can hold on to. Log rolls. or getting in and out of bed. Try doing this when you're getting up in the morning or going to bed. Note how Ricky rolls on the side first, uses his arm, and swings his legs down to the side at the same time. It's a great way to strengthen your upper body and your trunk. Remember the golden rule, we're trying to get 10 minutes of activity at a time ideally. Glute bridge. Bending over to get something or lifting something up. Butt taps on the wall is a way to get started. At the counter, you could think about bringing your hips towards and away from the counter as well. Trying to keep everything in perspective. For the exercises we've outlined in this video, let's say it took 1 minute for each exercise. We've given you 8 exercises, so assuming you've done each exercise for 1 minute each, that would be 8 minutes total. If you were able to do these twice a day, that would be a good total of 16, giving you a weekly total of anywhere from 100 to 112 minutes a week. That's a great place to get started if you've never exercised before.
If what we've shown you so far isn't meaningful, then really it comes down to trying something else. It really has to have a meaning to you. What our main point is, sit less and move more. Really, just try to get active.
In summary, do more neat activities. Really, trying to incorporate more activity into your daily lives. In other words, sit less, move more. Try getting off the bus a stop before your actual destination and walk the extra block. Or take the stairs instead of the elevator when you're shopping at the mall. Another thing you can do is try some fun cardio exercise.
Sign up for a dance class or take up golf.
Third, incorporate some strength exercises into your day. Maybe while watching TV or listening to music. Remember, a commercial break is 2 or 3 minutes where you could be exercising. For more exercises and resources, check out the following websites. We've got some great resources at our website, westcoastsci.com/diabetes.
If you missed anything from this video and would like to check it out again, or you'd like some suggestions on how to get yourself active, check out our website, westcoastsci.com/diabetes.